Hello, I'm Dr. Arnone. I'd like to welcome you to our program today. We have exciting news that can offer new hope for people with devastating conditions such as fibromyalgia, arthritic conditions, Crohn's disease, irritable bowel, and even migraine headaches.
And I'm Dr. Dantini, and I am here to introduce a new food allergy test for delayed food sensitivities. It allows us now to relate these delayed sensitivities to the chronic conditions that we're talking about.
So stay with us because the next half hour could very well change your life.
Welcome to Living Well Naturally. Brought to you by the Balanced Body Center and Sage Systems Incorporated. Join Dr. Phil Arnone and Dr. Daniel Dantini for today's discussion on food allergies.
Welcome to our program, and thank you for joining us. We have some exciting information to share with you today. Dan, perhaps you could open up by telling our audience a little bit about the science behind food allergies.
Science behind food allergies rests on the Gell-Coombs classification of sensitivity, which we've known about since the 1960s. We here in the United States have focused on IgE, which is an immediate allergy, and everyone knows that that can be tested for with skin testing or RAS testing. What we here at Sage have focused on is the non-E reactions, and there are three of them. One includes immunoglobulins G, A, and M, and those immunoglobulins connected with complement, which give immune complex reactions. And then there's a fourth type, cellular reactions, which involve complement also.
Yes.
The more serious diseases that we see, the more refractory to treatment they are, the more chance they have of being these delayed sensitivity reactions.
So if we had to oversimplify, whenever we're talking about the immune system, we break it down into the immune system having an immediate reaction and a delayed reaction. And everybody knows about this immediate reaction because that's the part of the immune system when they breathe in pollen, they start sneezing and their eyes itch. But it's this delayed immune system which is much more significant because these things, when they malfunction, they attack different parts of the body. They attack the small muscles in the bowels, causing constipation, diarrhea, resulting in Crohn's disease and irritable bowel. They can attack the smooth tendons and joints, causing irritation, inflammation, arthritis. The smooth tendons in the muscles, causing muscle pain and fibromyalgia. And even more so, the smooth arteries, the smooth muscles in the arteries, causing migraine headaches. And that's similar to an experience that you had.
Yes, I suffered from migraine headaches for probably about 20 years. My dad was a physician. He suffered from migraine headaches, and he said, Dan, you're going to suffer from migraine headaches your whole life. Get used to it. Well, as I was exploring these delayed food allergies, I thought, well, could migraines be related to delayed food allergies? And I had this huge list of foods I had to avoid, and lo and behold, my migraine headaches went away. I could reproduce them if I had coffee and beer, but it had to be on the same day. But my headache, if I had coffee or beer on the same day, like on Sunday, Monday, 2 o'clock in the afternoon, I get a migraine.
So not necessarily right away. It could be delayed.
Eat the food on Sunday, migraine on Monday.
So what's important to understand about this is the fact that these reactions were delayed, they were not immediate.
That's correct.
That's why it's so important to have the correct test. We're not talking about the test that you have in an allergist office for the scratch test that checks for immediate problems. We need a specialized test that checks for these delayed problems that occur 1 to 2 to 3 days later.
I wholly agree, Phil. I've done this work for 30 years, and I've never, ever had any success with skin testing or RAS testing. But the Sage food allergy test is very accurate and completely identifies all of these areas of delayed hypersensitivity.
And thanks to this new testing, we have all these patients that can get relief from these problems like migraines and irritable bowel and constipation. And why don't we go ahead and hear from some of those patients right now how they've recovered. Right.
I went to my physician, and my physician sent me over to orthopedic clinic, which is what physicians typically do. And we had all sorts of tests and CAT scans and MRIs, and they said, gee, your neck's in bad shape. He said, you know what, you're a great candidate in a few years for us to chip bone off your hip and fuse your neck. And I said, gee, that sounds pretty bad. So I went back seeking to find chiropractors that could get the job done, and fortunately somebody mentioned Phil Arnone to me, and I started going to Phil just as I had my first baby girl, who's now 7. And I said, Phil, there are days I get up where I can't even hold my girl because my neck is bothering me so much. So I said, I really need some help. Do you think you can help me? He asked me one day, how are you doing? I said, I'm going through a period of time where I occasionally have these headaches, and they're called cluster headaches. They're short, intense, and gone, but then I'll have them for a month at a time. So, I said, I don't understand it. He said, well, have you ever been tested for food allergies or food sensitivity? I'm sure someone's told you in the past that oftentimes these headaches are triggered by foods, or can be. And I said, yeah, they've mentioned that. And he said, well, why don't we take you through that and see what we find out? And we found out a lot. I mean, my quality of life today is just fantastic. And if you do the before and the after, I mean, it's just a world of difference. The path I was on versus what I'm doing today, I mean, it's above and beyond acceptable. It's fantastic.
I used to think that people who had headaches were real wimps. Now, oh, I got a headache, and I used to think, oh, just suck it up. Well, then I got headaches, and I started to realize that, wow, there are some headaches that can really be painful. And for mine, they were always kind of over on my right side of my temple, and they would just pound and throb to the point where it was interfering with my work, my quality of life. I went to the emergency room once because I really thought there might be something more serious going on. When you have a headache for 4 days, you're thinking, what is this? I was introduced to the SAGE system, a food allergy system that tests what foods you might be allergic to. No one had ever said, I think you've got a food allergy, so I was like, food allergy? I was amazed, and it was like a miracle. I could not believe that going through this process, which I never would have thought of on my own, and which no one in the medical community had ever suggested, that this really was the magic that got rid of my migraines.
It's always great to hear stories of success like that, and we have hundreds of patients that have similar conditions. They have migraines, they've had them for years. We identify the foods with the appropriate testing. We then take the foods out, and then these people are free to choose to live a healthy life without the use of medications and to be free from their symptoms. But what's important to understand here is it's not just always bad foods. It's not just that a person is going to eat wheat and have problems, or they're going to eat sugar.
That's it. Good foods can make you sick.
Exactly.
Like tomatoes make me sick.
We could have
and I'm Italian.
We could have one person that eats tomatoes and they have migraines, and another person, cucumbers and broccoli can cause irritable bowel or joint problems. And how does that happen, Dan? What happens that someone's allergic to a tomato and it causes joint pain?
Well, we're not sure exactly the determination as to what affects the end result, but we do know that this has to do with the genetics of the individual. If you're a genetically pre-programmed individual to have allergy, and you eat the same things all the time, and we all eat the same things all the time. I grew up on spaghetti sauce and pasta.
Of course.
Guess what my problem is? But anyway, we eat the same things all the time, and these things build up in our intestinal tract. And in allergic individuals, some of those partially digested protein digestive products get across the gut barrier. They get into the portal circulation, they go to the liver. The liver says, I'm not supposed to see you here. I'm supposed to see an amino acid. And this is not an amino acid. It hasn't been broken down enough. So antibodies are produced. The next time you eat that food, the antibodies react in a more strenuous way. You get irritable bowel disease, you get cramps, gas, and diarrhea, and that is an indication that you are rejecting that food.
And that's similar to what we're talking about, the leaky gut syndrome. And as we look at our slide, we can see when we're looking at the slide of leaky gut, we have these yellow balls that are seeping through into the bloodstream.
Yeah, those are the protein, partially digested proteins. They shouldn't be going through the gut wall.
And as they get through, those are the things that are creating the symptoms of bowel problems, joint problems, muscle problems. And we could hear from a few more of those people that have these bowel problems now, and let's hear what kind of success they've had.
The symptoms were, as I indicated, a lot of intestinal distress, to put it nicely. And gas. I used to make a joke about the fact that if Goodyear would bring their blimp here, I could take care of all their needs. It was to the point where I hesitated to be out in polite company, seriously, because I couldn't control it. And very embarrassing and painful to boot. Well, I had 2 hospital stays. Still, you know, the doctors say, no, we can't find anything wrong. No, physiologically, no problems. But I still had the problem. But when I went to Dr. Arnone, he was able to give me a diagnosis. Well, it has changed my situation considerably. I'm not embarrassed to be out in company any longer. I had no idea you could test blood for food allergies. And so the exposure to the SAGE systems and their ability to do this and come up with results as they did with this computer printout was absolutely amazing. And of course, very productive. Just feels so much better. It's just so good to feel good. I guess that's in a nutshell.
It's the type of an issue where it's always on your mind. You never know when some of the symptoms may occur and come forward. I was actually a teenager when I found out I had Crohn's disease. There were definitely times when it was very painful, and through the years I've been hospitalized many times. You know, it never occurred to me that foods could be the major factor that could help me control Crohn's. Really, I think it's just, when you look at the entire picture of what it's done for me, it's changed my life dramatically from the standpoint I don't feel weak and tired. I don't have the day-to-day symptoms of Crohn's that I had for many years. I go today and I take no medication for Crohn's at all. So it's made a huge difference overall. And I've been on this for over 3 years. So it's not that it's a short-term answer, it's a longer-term answer.
Phil, we have excellent success rate with the SAGE food allergy test. GI problems like Crohn's and irritable bowel and reflux get totally better. It's amazing. And it happens within 6 weeks. Now, the arthritic problems like fibromyalgia and degenerative arthritis sometimes take months. But I think it's important to give people the alternative to allow them to choose to get to the root of the problem.
And that's exactly what we're doing here. By testing people with the appropriate testing and giving them the elimination diet, we're giving people the choice so that they can now stay healthy naturally, get well from these things like irritable bowel, diarrhea, constipation, Crohn's disease, and have a choice to live a healthy life. But the testing needs to be done, the appropriate foods need to be identified, and we need to eliminate them over the course of time.
But I think we need to give people a choice. They have a choice. They can use Band-Aid medicine.
Dan, maybe you could explain for our audience a little bit more clearly what you mean by Band-Aid medicine.
Band-Aid medicine. Band-Aid medicine is taking a pill for a symptom. And most of medicine is that way. If you have a migraine headache and you go to your doctor, he'll give you Imitrex. It takes care of the problem when it occurs, but it occurs again. If you have irritable bowel syndrome, they have a new medicine called Zelnorm. You take that, it's supposed to get rid of your irritable bowel symptoms, but it doesn't cure the problem. It puts the Band-Aid on your disease. It's much better if you get to the root of the problem by using the SAGE allergy test, eliminating the cause of the problem, then you don't have to take medicine.
And choose a more natural option.
I think that's the best way.
And we've got a lot of information yet to come, so stay with us as we take a short break.
Your next phone call could literally change your life. Migraines, Crohn's disease, joint and muscle pain, fibromyalgia. If you can identify with